The problem with fistula is old. Most, even good general surgeons, they try to get away from treating fistulas because they're known for their recurrences and they're a little bit dangerous as far as most general surgeons are concerned because you're working within very delicate structure, which is the sphincter. This is how we control our bowel move. Basically, the anal canal has what we call the anal sphincter, which are two layers, one internal, one external, and fistulas appears right there and cause difficulties in their treatment. Most surgeries and innovation try to cut portion of these muscles, the sphincters, or try to burn the fistula, or try to plug the fistula with a special plug. All these methods actually failed. There was another method is trying to do a mucosal advancement flap, was very involved procedure and ended up with 50% recurrence, which was also unacceptable. So the issue of fistula remained unsolved. It started to improve a little bit once the lift procedure was developed. This is basically a method that was developed from Japan, where a surgeon actually ventured into going into between the two sphincters and tried to ligate the fistula in there. That worked, but worked for only like 5 to 10% of the fistula cases. We simply went back to the books and we reviewed and we started to think out of the box. Why these fistula recur once we treat them? And what is the original cause of it? Is that deep thought and accumulative experience and the large group of surgeons doing the same thing and the active discussions that finally solved the issue. Because we identified the real reason behind the formation of these fistulas and why they recur if we don't address that particular issue. And that was the base of all our new method. But since that discovery, that innovation, this procedure that we came up with, we barely, if ever, have any recurrence. And without complication, something we can do still on an outpatient basis with excellent results. And we are very proud of the results that we have. And we became a referral center for almost all complicated fistulas in the Middle East.